Huntington disease is an inherited neurodegenerative disorder caused by a mutation in the HTT gene located on chromosome 4. This mutation leads to the production of an abnormal Huntington protein, which gradually damages nerve cells in the brain, especially in the regions responsible for movement, thinking, and behavior. Because the disease is inherited in an autosomal dominant pattern, a child of an affected parent has a 50% chance of inheriting the condition. The hallmark symptom of Huntington disease is chorea, which refers to involuntary, jerky dance-like movements. However, the disease affects much more than movement. Patients may experience difficulty with coordination and balance, slurred speech, problems in swallowing, depression, anxiety, irritability and personality changes, memory loss, and impaired decision making. As the disease progresses, cognitive decline can eventually lead to severe dementia. Symptoms usually begin between the ages of 30 and 50 years. However, there is also a juvenile form of Huntington disease that can appear during childhood or adolescence. The juvenile form often progresses more rapidly and may present with stiffness, seizures, learning difficulties, rather than chorea. Diagnosis begins with a detailed medical history and family history. Doctors look for characteristic movement abnormalities, psychiatric symptoms, and cognitive changes. The diagnosis can then be confirmed through genetic testing, which identifies an abnormal expansion of CAG repeats in the HTT gene. Brain imaging studies such as MRI may also show degeneration in specific brain regions, particularly the caudate nucleus and putamen. Unfortunately, there is currently no cure for Huntington disease. Treatment focuses on managing symptoms and improving quality of life. Medications can help reduce involuntary movements and control psychiatric symptoms such as depression, anxiety. Physical therapy, occupational therapy, and speech therapy are also important components of patient care. Researchers continue to investigate gene targeted therapies that may slow or prevent disease progression in the future. Huntington disease is a progressive condition. After symptoms first appear, patients typically survive for approximately 15 to 20 years. Over time, increasing disability affects mobility, communication, and independence. Complications such as infections, holes, and swallowing difficulties are common causes of deaths.